So a little bit about, and thank you, Patrick, for sharing these and tag teaming with me here. But so a little bit about the Center for Active Design. We are a international nonprofit that's been around for about 8 to 10 years now, and kind of our main goal is to foster and help advance design and operational solutions to create healthier, engaged, and more resilient communities. And we actually got our start out of the former New York City Mayor Michael Bloomberg's administration. He led an interagency collaboration that looked to produce the first kind of publication that took professional health research and professional health data and turned it into solutions for cities and the real estate community and the design community to help kind of foster healthy outcomes. And that publication was the Active Design Guidelines, and it launched in 2010. And there was a lot of kind of great excitement and interest in utilizing that publication, not just in New York, but really globally. And they wanted to kind of roll out an organization to continue the work of that collaboration and continue to kind of advocate for those active design guidelines. So if I can put into a single statement, what the Center for Active Design, or CFAD, does is that we translate research into practice. And we do that, lots of ways through things like affordable housing and neighborhood scale development. And probably our main way is through our flagship program, Fitwel, the Fitwel certification system. So next slide, Patrick. And Fitwel is a building certification system that really looks to optimize all buildings and communities to support the well-being of people that live, that work, that visit, and occupy those spaces. And we have been around, we launched publicly in March of 2017, and we've seen some really incredible growth since then. And our tagline is building health for all, and we do that by providing a series of strategies for different asset types that look at both operational and designs of buildings and how they can be utilized to kind of improve health and enhance the well-being of those occupants that are there. Fitwel was not designed or created by CFAD, actually. It was created by the Center for Disease Control and the General Services Administration. Between the years of 2010 and 2015, the CDC did a large kind of literature review of over 3,000 research studies, and then piloted those strategies that they came up with after doing that review across a number of GSA buildings, both those in urban locations, in rural, and suburban. They looked at historically designated buildings as well as those that were new construction to make sure that Fitwel could be applied across the portfolio and not just on new construction or legacy buildings. And I think that's one of the central features that makes Fitwel so unique to the marketplace, is that it's really been designed in the way that it's priced, in the products that are made available, in the design of the technology and the scorecards and strategies themselves, to be an enterprise-wide solution that companies and developers and designers can use across any number of projects or locations or clients, and not just be reserved for kind of flagship buildings in central business districts or legacy projects within their portfolio. Because we take a very holistic and interrelated approach to health, and I think one of our founding ideas is that to really impact health across your organization or across your portfolio, you need solutions that you can implement widely and that are scalable and can be applied to different asset types, different typologies, and different densities. So next slide, Patrick, if you will. And just to maybe show off a little bit, but in the 3.5 years that Fitwel has been around, we've seen some tremendous growth globally. And I'm proud to report that as of today, we have about 560 projects that are certified or pending certification. That means that they've been submitted and they're just awaiting their final certification materials. Another almost 2,000 projects that are registered and pursuing Fitwel certification. We have about 4,300 global users across 40 plus countries. So really proud of the growth we've been able to accomplish. And I think it's a testament to the solutions that we've provided, and I think the growing understanding of the way that our built environment impacts our health. And, 2020 has certainly been a challenging year for every industry. And I think, at least in the real estate community and the design community, one silver lining is that there's been this heightened awareness of the connection between health and our built environment. And that has led a lot of people to ask questions about healthy building practices and become more engaged with thinking about how they can promote health within their structures or within their organization through their operations, their management, and kind of just the overall design and accessibility. Next slide, Patrick. And one way that we kind of grow our program, and one that we share a program with individuals, and is through a series of partnerships. And the one partnership I just want to touch on for everyone on the call is our Fitwel Ambassadors program. It's a personal accreditation akin to maybe a LEED Green Associate, but it allows individuals to better understand the link between health and the built environment, as well as get a kind of deeper dive into the Fitwel scorecards that are out there, the certification system and process as a whole, as well as the Fitwel portal, our website where all certifications happen on. So it's a wonderful program. To learn more, you can go to fitwel.org/ambassadors and see kind of what else is out there, what the benefits are, and what some of the requirements are to become a Fitwel ambassador. I think we have some on the call just by looking at some of the names that I saw join the first few minutes. So more information about that's there. And then we have champion affiliate programs that are designed to help companies partner with Fitwel. And again, more can be found on fitwel.org regarding those. Next slide, Patrick. And now for kind of the bread and butter of today, the viral response certification and module. And, as I mentioned, this is a product and a certification that really developed out of COVID-19 and the need for to provide a way for our industry leaders and the commercial real estate community and the design community to address the needs from their stakeholders. So just very quickly identifying what the module is, it's kind of an annual third-party certification of operational policies and practices that help to mitigate the spread of contagious diseases within buildings. And I use the word contagious diseases very for a reason. And while the module and the certification were created because of the need of COVID-19, we wanted this module to be able to help companies be a long-term goal towards resiliency. So the module really developed to not only prevent and mitigate the spread of contagious diseases like COVID-19, but we also took research around things like the common flu or the common cold. We looked at other pandemics and endemics like SARS and H1N1. We even looked at things like Legionella disease and strep throat. And we took research that we had from infectious disease and from other respiratory infectious diseases to really create a module that could be used to address the needs of COVID-19 in the current pandemic, but that also would provide a really strong framework for any kind of future outbreaks or future contagious disease outbreaks that might come along. And, unfortunately, when, listening and learning from our leading public health experts and health organizations, it is not going to be probably the only pandemic that we live through. There may be future endemics and pandemics that we experience. And we wanted to make sure that this module was founded in something that would create a great foundation for companies, and then we could build off. Because certainly while COVID-19 acts and behaves very uniquely within buildings and among populations compared to, let's say, the annual flu, there are some kind of universal basics that can be found across almost any contagious or respiratory infectious disease. And by putting into practice those kind of universal findings, we're able to impact how most of these contagious diseases or respiratory infectious diseases spread, including COVID-19. As with anything with Fitwel, everything is based off the latest public health research. So we've worked with a large academic contingency to help us understand the latest research out there. We continue to work to make sure that all strategies within Fitwel are evidence-based and credible. And I mentioned that the CDC, when they were creating Fitwel, had a evidence base of about 3,000 research studies. Today, the evidence base behind Fitwel is a little bit closer to 5,600 and probably closer to 6,000 after all the research that's been done around COVID-19 this year and other kind of infectious and contagious diseases. So Fitwel continually, and the Center for Product Design continually conduct those literature reviews to make sure we're up to date on the latest research out there, and that we're drafting strategies that kind of are going to be responsive and effective for our building owners and designers. Next slide, Patrick.
Sorry, I lost it there. I'm not sure what just happened.
Perfect.
Oh, should I jump one?
Yes, go back one more if you don't mind. Perfect. So a little bit of the module development. So this vol response module was actually the second step in a larger process. Between March and June of 2020, Fitwel released a series called Research to Action. And it was a 5-chapter series that really was designed to answer the questions of our community. In March, I'm based in New York City, and in March when a lot of things started shutting down and COVID-19 and the pandemic became very apparent that it was going to change the way we did business for the next few months, we needed to address some of the concerns from our community and answer their questions. And we put out this series that I think, if I can describe it, is super powerful, but very concise. And I've heard nothing but, I think, positive feedback about it, but it was meant to kind of answer different needs and questions. So chapter 1 here is all about what is COVID-19, how is it spread, and what can buildings do to mitigate that spread. Chapter 3 was all about building trust among occupants. So whether you had residents in a multifamily building, you were a multi-tenanted commercial office building, or any type of structure, how do you kind of build trust among your employees or among your tenants or residents, the work that you're doing, and make sure that they feel comfortable with the steps you're taking. And then the final chapters kind of look more at some broad brushstroke strategies, things like conversations around density and its positive benefits for health, or things around comorbidities and how kind of chronic diseases were impacting the spread and behavior of COVID-19. So all these chapters are free to download on fitwel.org. But this was really the first step in the creation of this module, or the creation of this certification. As of June, once these were all published, the community really wanted that third-party stamp of approval. They had some of these solutions that could drive them. They read the chapters and learned what was possible, but they really wanted something to communicate to employees and tenants and residents that they had gone through a process of achieving a third-party certification, receiving that stamp of approval from accredited company. And that's how the module really came to be. So we've really operationalized and conceptualized the information that's found within those 5 chapters, and put it into this kind of certification that's more akin to the Fitwel scorecards and the Fitwel certification process. Patrick, my screen's all white now. I don't know if yours.
Yeah, mine just shifted as soon as I touched one thing. Let's try it again. So that's the. Sorry, everyone, for the technical issues. All right, we back?
We are.
Is this the slide you want?
Next slide, please. Thank you.
All right.
Perfect. Go back one, if you don't mind. Perfect. So as with anything with Fitwel, we kind of work with our leading real estate partners to help us make sure that any product or module that we're coming out with represents kind of the diverse portfolios or geographies, and make sure that what we're writing and providing as solutions are applicable and scalable to our community. As I mentioned, Fitwel and kind of the way we've designed the entire system is that it's something that can be used portfolio-wide. So we worked with 8 leading real estate companies to help kind of prototype this module and make sure that the solutions were not only viable, but that they were feasible for different types of assets or different locations of assets. So here's just a sample of 5 down here that represent kind of large portfolios across North America as well as internationally. But the big piece to take away from here is that, you know, we work not only with the research side to understand where the research lands us, but to make sure that we turn that into kind of credible and practical solutions for our community so that they can be adopted widely. Next slide, Patrick. Perfect. And so besides our industry advisors, we also brought in a kind of large team of academic advisors to help with the development and research behind the module. So to today, the Center for Active Design still partners with CFAD. They're kind of our major research partner to help us understand the growing evidence base and how we can translate that research into strategies. So they certainly had influence on this module, but we wanted to bring in a larger group of health experts to also give us some visibility into kind of other fields like public health, mental health, and psychology. So we had this wonderful team of about 12 academic advisors who helped give us that kind of different information and viewpoints that we needed and made sure we were up to date on how this pandemic and COVID-19 and past pandemics and endemics have impacted populations. I think we've all realized now that the impacts of COVID-19 go far beyond just our physical health implications, but there's certainly a mental health and social health component that are impacted by the responses to pandemics and by the response to COVID-19 in particular. So making sure that within this module and the certification, we not only addressed physical health concerns, but also put in solutions to help address mental and social health concerns was really important for us. So again, just to share the various academic advisors who have supported us in the creation and the continued development of this module. And as the research around COVID is continuing to evolve, we will continue to update some of those resources like the Research to Action series. We continue to work with these academic advisors to understand what's available, what information is available, and how we can continue to evolve solutions to meet the needs of our community. Next slide, Patrick. And that's really the development of the module and some of the research that went behind it. So I'd like to pivot a little bit now to the actual application of the module and how you can go about kind of applying it to different users and talk you through some more of the content and research behind it. So next slide, Patrick. So the first thing I like to always point out is that the Fitwel Viral Response certification and the module that you use to certify is a separate product from our Fitwel scorecard. So for those of you who have used Fitwel in the past are familiar with our workplace and multifamily residential scorecards, as well as our community and commercial site ones. This is a different product, and the reason it's different, and we didn't just bake it into our current scorecards and certification materials, is that we wanted it to apply to a really broad list of commercial and residential asset typologies. So while our Fitwel certification scorecards are really focused on commercial workplaces, multifamily residential, and retail, we wanted this module to be applied to things like hotels, academic spaces, industrial, senior housing, and even hospitality. So this module allows for a kind of broader approach for how companies can not only approach kind of healthy building practices, but again, making sure that they can apply this module across any asset that they might have in really any asset they might have within their portfolio. If you don't see an asset type listed here, you can always email info@fitwel.org and ask if that's an appropriate asset to apply the module to, and they'll get back to you in a short period of time. Next slide, Patrick. So the module actually is set up in a two-step process, and it was set up this way for, again, scalability and kind of adaptability across kind of diverse portfolios. So there are two steps. The first step is really establishing a response to COVID-19 and the pandemic, and really kind of certifying a entity's response and their intention for how they're going to address COVID-19. And then step two is really showing how you've taken those kind of operational policies and protocols that you established in step one, and how you've successfully implemented them across your individual assets or across your portfolio. So step one is really achieved at the kind of corporate level or the portfolio level, whereas step two is really achieved at the individual asset or building level. And if I can give you some examples of how our industry advisors have approached this, a company like Tishman Speyer, they've adopted the module in step one for different kind of regions within their portfolio. So they might have different policies based off if they have assets in the UK or Europe based off North America, because maybe there are different requirements they need to follow. So they've actually looked at step one and said, we're going to apply this module in two parts, one part to our North American portfolio, one part to our kind of UK or European portfolio. A company like Harrison Street has adopted this policy across their entire company. So their entire portfolio, all of their holdings, they've established a single kind of module for and a single response that they're using across all asset types, across all locations. So step one gives you a lot of flexibility. It can be used you can establish this module and achieve certification for your entire portfolio or for your client's entire portfolio. Or you can use it on just a subset of assets. So maybe a client just wants to start with their US office assets and certify the response they're putting into place for those. Maybe there's a company who just wants to focus on their industrial assets across North America. You have a lot of freedom to how you want to establish step one, and that's why we use the phrase kind of entity level. You get to choose what that entity is, whether it's a diverse portfolio or whether it's an entire company. But once that kind of portfolio or company has adopted those policies and they've been certified, you can then go show how those policies and protocols have been implemented in different assets. So again, we'll take Harrison Street as an example. They adopt these policies and protocols across their entire portfolio or for their entire portfolio. And then they might take a couple individual buildings or see a subset of those individual buildings and show how they've specifically implemented them. So they'll go through and each building will apply for kind of step two and receive approval for the way they've applied that. So this two-step model allows companies to very quickly kind of make sure they have the appropriate policies and frameworks in place, and then work to make sure that they're implemented at each of the different assets. And that's an important step because what we heard from a lot of our users early on was that they were getting a lot of questions or asks from individual property teams or facility teams or asset managers about what to do or what to provide, and they wanted to have basically a playbook or a series of strategies that they could give to each property manager, each asset manager to say, these are the things that you can do on site. These are the appropriate policies and protocols we want you to implement to address COVID-19 and to kind of build trust among your tenants or your employees on site or your residents. So by allowing them to create that playbook first of kind of certified and credible strategies and then implement at the buildings, they were able to more quickly kind of achieve a singular response at scale. Next slide, Patrick. And I just wanted to kind of show the two steps at different ways. So again, step one, you're receiving that kind of viral response certification for those operational policies and practices. Step two, you're receiving kind of that viral response approval at each asset. At the asset level, you'll be able to order some type of decal or marketing piece to put on the building to communicate to tenants or employees or visitors of this building's achievement. But I also wanted to showcase that this module is really a stepping stone to the more comprehensive and broader Fitwel certification. And, as I mentioned, more people this year than ever, I think, have a heightened awareness of the connection between health and the built environment. And this module might be their first take at really addressing health through policies and procedures. So the efforts that companies take to achieve this viral response certification and viral response approval, because that's the need of their community now, those efforts can then directly be pulled into future Fitwel building certification. So again, I'll use a building here in New York, 110 Wall Street. If the owner of 110 Wall Street achieves Viral Response certification and approval for that individual building in, let's say, Q4 of 2020, and then in Q1 of 2021, they want to achieve kind of Fitwel certification using one of the building scorecards. The efforts they took to create these policies and receive credit for the module will be pre-populated and automatically pulled. So when they begin that Fitwel building certification in 2021, they won't be starting from 0 points. They'll have a good foundation, and they'll actually be starting from 10, 20 points, and they'll be able to use some of that documentation and have it pre-populated into those buildings. So again, all to say, the Viral Response module really acts as a stepping stone to the full Fitwel building certification. And that's an important step because the full Fitwel building certification really looks at chronic disease and how you can take a very holistic and interrelated approach. And within those scorecards that really been around since 2017, 2018, infectious disease plays a role in there. We've always had things like hand washing signage and indoor environmental quality strategies and strategies around cleaning protocols. This module, as you can imagine, looks very specifically at infectious disease and really heightens those strategies to address COVID-19 and what we've learned about infectious disease through kind of a deeper, more strategic lens. So there are overlap between the module and the building certification. The portal in the system is set up to allow you to use efforts in the module to impact that building certification. Next slide, Patrick. And I wanted to just talk about kind of what you get upon certification by using this module. And for, again, those familiar with Fitwel, this is a little bit different. The Fitwel building scorecards use a STAR rating system, so buildings either achieve 1, 2, or 3 stars. This module you'll either be Viral Response certified or Viral Response certified with distinction. So it's out of 100%, and those buildings who achieve 70% are able to be certified, and those who achieve 90% are able to be certified with distinction. Just our way of acknowledging companies who really adopt the module in their entirety and are able to apply almost all of the strategies to their playbook for their assets. And then the icon there is just kind of a sample of what that kind of material will look like, that decal, that marketing material for those buildings and for those entities. Next slide, Patrick. And then just a couple more slides on the application before we get into content. I just wanted to give everyone a timeline. That's always a question I get, is what is the process for achieving the certification? So for step 1, it's a 6-week timeline. It follows Fitwel's traditional 3 phases, where you submit a project, it goes through an initial review. You then enter phase 2, where the project team will receive a review report, be able to respond and upload additional documentation and provide any clarifications as needed. And then they'll resubmit the project to go through a final review, upon which the project will receive a final score and a final certification designation. So again, those familiar with Fitwel building certification knows that this is a much shorter timeline than for the building scorecards. And that's because this module includes about 20 strategies, whereas the larger Fitwel building and site scorecards have about 70+ strategies. So a smaller number of strategies, so a smaller timeline to review and provide certification. Next slide, Patrick. And then for step 2, asset level approval, it's pretty quick. It's about 2 weeks. So you'll submit your asset level approval, and then after 2 weeks, you'll receive the final kind of approval or certification for those individual assets. So again, the bulk of the kind of work in terms of documentation and certification happens in step 1. And then step 2 is a pretty quick and scalable approach for getting assets within that portfolio or across that company on that stamp of approval. So again, if a client is looking to do their entire portfolio, it would take about 8 weeks to move through the step 1 as well as step 2. Next slide, Patrick. And then again, Everything with Fitwel happens on our Fitwel portal. It's our tech platform. We've worked with our different organizations to design it and different partners to help design what's on there. The module is fully integrated within the online portal. It allows you to easily navigate between kind of building scorecards and this bioresponse module. So more information on our website about how the portal works. And again, as a Fitwel ambassador, you'll get more insight into the functionality and the tools behind this portal. Next slide, Patrick. So now I want to break into the content a little bit here and some of the research behind and just give you kind of a little bit of a highlight. And I'm not going to go through each strategy in great detail, but I'll tell you where those resources can be found. I want to make sure that this is a kind of a higher level conversation around each of the strategies that you'll encounter within the module. But there are 3 sections within this module. So there's enhanced indoor environments that really looks at indoor operations and the management and maintenance of these specific buildings. Section 2 is encourage behavioral change. This is how we can design these structures to kind of elicit the decision-making or the type of behaviors we want to see. So if we want to see kind of mask wearing within buildings, or we want to see people kind of staying 6 feet apart or physical distancing, that's found in kind of section 2. And the final section, build occupant trust, that's really looking at the resiliency aspects of this pandemic and this fire response module. But how do you build trust among your occupants or your employees through things like emergency preparedness plans, communication structures, and kind of collaborative feedback. Next slide, Patrick. So one thing that's really unique to this module is that we have minimum requirements, and within the traditional Fitwel building scorecards, we don't have minimum requirements. It's really kind of an open playbook for companies to decide what strategies they want to use based off occupant profile and location and local health issues. But for this module, there are minimum requirements, and that was really important to our research team and to our staff internally because, as I said, there's some universal basics that are consistent whether you're looking at COVID-19 or whether you're looking at H1N1 or kind of the common cold. And we did not feel comfortable ever certifying a project without having some of these basics in place. So an example I always give is having an enhanced cleaning and disinfecting protocol. Without having that cleaning and disinfecting protocol, we would feel uncomfortable saying that a building had kind of achieved this well response certification. Same could be said for some minimum ventilation and filtration practices that companies will need to follow in order to kind of successfully mitigate the spread of COVID-19 or other contagious or respiratory infectious diseases within the indoor air. So there are some minimum requirements that you'll have to achieve before you can achieve certification. So even if you crest that 70% threshold, if you haven't met one of these, you will not be able to achieve certification. An important highlight, I think, for those familiar with the Fitwel certification scorecards. Next slide, Patrick. And then last kind of strategy designation before we get into the individual sections. Some strategies you'll see have a capital D, capital S after them, and these are dependent strategies. And these are really, if you will, child strategies to parent strategies. So these are there to help kind of enhance or amplify the impact of the parent strategy, and can only be achieved once kind of the associated strategy has been achieved first. So you'll see that in a couple sections, there's this kind of dependent strategy that's kind of tied to the being able to achieve a parent or associated strategy. But again, these ones are, if you achieve strategy 1.1, you can then achieve the dependent strategy that goes along with it. Next slide, Patrick. So jumping into section 1, again, I don't want to go over each strategy in too much detail, but I want to just make sure everyone is aware of the different expectations that are kind of required of companies as they begin to process this module and achieve VAL response certification. So you can see in the section there are 2 kind of minimum requirements. There's established enhanced indoor air quality policy and established enhanced cleaning and disinfecting policy. Both of them have a dependent strategy. But the strategies are really written to, again, be broadly applied. So these strategies, and most of these are policies, There's two things I want to highlight here. One is that most of these policies come with a policy template. So it'll be written out, and it's a guide that companies can either adopt as it is, so they can copy and paste and add the unique and detailed language that are required. And that's really powerful for companies who maybe don't have an air quality policy written, or don't have kind of an air quality testing protocol that's provided for them, or that they have already established. So those templates go a long way to helping companies really put these things into a framework if they don't have it already. Otherwise, those templates are really powerful for helping companies who might have an indoor air quality policy already say, where can we kind of enhance our language? Where can we kind of refine our language to meet the latest research that's out there and make sure we actually have a very effective and impactful policy that we're implementing? So those templates are a huge help, I think, to companies. And the second thing here is that these policies are really written to be full of kind of recommendations in terms of how we want companies to approach. So if I look at enhanced indoor air quality policies, you know, when it comes down to kind of filtration, we're looking at, or I should say ventilation, we're looking at things like, we recommend the use of MERV 13 filters across your assets. But certainly some companies and many organizations are going to have some assets where maybe MERV 13 filters aren't feasible without kind of major updates to the building, or maybe they even have buildings where it's just not possible to put those in. We provide additional pathways to kind of additional ventilation and filtration practices that are possible for these buildings. So none of these policies really have an end-all, be-all, especially when it comes to indoor air quality or things like water management plans. We're really providing what we feel are comprehensive policies that allow companies to use it to help address ventilation and address water management and other strategies here within different buildings. So whether you have buildings that are Class A or Class B, whether you have a mix of multifamily, traditional commercial offices, and industrial. The policies are pretty detailed, but flexible in allowing you to change up how each building might successfully adopt the policy, again, based off their current systems, their occupant profiles, things along those lines. A few other things I'll point out here is that in 1.2, establish an enhanced indoor air quality testing protocol. To achieve the kind of VAR response certification at the company level, we don't actually require air quality testing at this step. What we want to see is that you have a protocol in place that outlines exactly when, where and how and what you should be testing for. As many buildings are still well below normal occupancy levels, testing right now is a little bit skewed because you don't have people actually in the building. But what we want to do is make sure that as people think about bringing people back to the office, as those occupancy numbers rise, people have the appropriate protocols to understand, when should I be testing the indoor air quality? What should I be looking for? And what are those kind of action thresholds and limits that are really important to us? And then 1.4, kind of enhanced cleaning, disinfecting, and maintenance protocol, really identifying what areas need to be cleaned versus what areas require maybe disinfection. We're looking at providing you what type of active ingredients you should be looking for in disinfectants as well as within cleaning products. Certainly there's been some recalls this year, and there's been some research around what kind of active ingredients are actually safest for kind of humans, and what procurement guidelines are available to help you identify what products are best used and are, I'll say, safe in terms of human health. Next slide, Patrick. And just to provide a little bit of kind of research behind this, I always love to throw in some fast facts here. What we saw from a study that was done is that it really predicts, based off kind of this Wells-Riley model, that the risk of infection in an environment using a MERV 13 or greater filter is 31 to 47% lower than a similar space without any filtration. And it's a collection of research around kind of filtration methods, working with organizations like ASHRAE and other leading indoor air quality and mechanical kind of associations, understanding kind of what the research is out there, working with them to understand what's a best practice. But, we've chosen, MERV 13 as that kind of recommended, I'll say, filtration model, because it's the research is the most proven. But again, this is one of those minimum requirements where there's such a strong base of evidence that this practice in itself is super impactful in reducing the spread of infectious diseases and different types of contagious diseases, and reducing transmission of those among buildings, among occupants within those buildings. Next slide, Patrick. Section 2 is kind of encourage behavioral change. So again, enlisting that decision-making that we're looking for and helping understand how we can kind of get certain people to make certain decisions on site. So there's three minimum requirements here. There's personal protective equipment, hand hygiene support, and then select educational health promotion signage. So that personal protective equipment is all around the use of things like masks and gloves and eye protection for individuals that might be working on site. So if you are a building owner, we're looking at, the maintenance and operations staff that's on site, especially when they're in common spaces or entering things like tenant spaces. It provides guidelines for kind of what to provide, when it should be used, who should be wearing it. It also provides some information on things like training or kind of educational materials about what are the health benefits of using this PPE. And certainly one that has grown as the research has evolved over the last kind of few months, or I should say from spring of 2020 to fall of 2020, this was really kind of an important strategy that, was really emerging, I think, back when we were putting out those research to action series, but it's really been solidified by the research over the last few months. This one has a dependent strategy, and it's about a provision plan for PPE, and that's really kind of getting at the equity concept behind some of these strategies, and that's found within kind of Fitwel's kind of health impact categories. But this dependent strategy is all about, do you have a stockpile on site in case a third-party contractor or an employee or someone enters the building without a mask, or a third-party kind of contractor doesn't have the appropriate PPE? Do you have a stockpile that you can provide them to actually and effectively kind of maintain those guidelines that you've established in 2.2. 2.3 is all about hand hygiene support. And again, one of the most common ways, and I think one way that we've all, have been hearing since we were probably kids, washing our hands is one of the most effective ways of minimizing the transmission of different contagious and infectious diseases. So having that appropriate hand hygiene support within bathrooms, and this is a strategy that you'll find within the building scorecards and has been part of Fitwel since its launch in 2017. But really focusing on what setups do you need within bathrooms, but also what setups do you need maybe in high traffic areas. So we've seen the rise of hand sanitizer stations within entryway systems and in lobbies and in kind of major traffic areas. It'll look at what type of hand sanitizers are appropriate, what active ingredients you should be looking for, things like that. 2.4, health, select educational health promotion signage. For those familiar with Fitwel, that signage plays a role in several strategies, and that's because the research is pretty comprehensive, that when you have this type of signage available, it actually does elicit certain behaviors, and it does nudge people to make certain behaviors. So while we are asking for things like hand washing signage in bathrooms, there's also opportunities to place different types of signage in different areas to elicit other behaviors like physical distancing, mask wearing. You might create different corridors for entries and exits, or for going, traversing up a building, or kind of traversing down to the lower levels. Whatever kind of solutions you might be looking for within your building based off its design or occupant profile. We provide a series of signs that you can use, and you'll have to show at each asset that you've implemented a certain percentage of those. So again, providing that level of flexibility to understand that each building is going to have a different needs, maybe based off regional guidance, or maybe based off the number of occupants or the type of occupant that's there. And then 2.5 and its dependent strategy, 2.5.1. those are really designed to look at kind of health and mental health and social health. So these are two kind of big, I'd say, mental health and social health strategies, looking at, are you providing the appropriate programming and support groups on site for your employees, or virtually, say, for your organization, that help provide people those opportunities to gather and share experiences, or provide things like health services, or mental health programming, or other types of fitness and nutrition programming that's available. Again, we provide a bunch of options that are feasible. You'll show, which ones have been implemented in different buildings based, again, off an array of factors. Next slide, Patrick. And I always bring up hand hygiene because this is one where I think the research is incredibly strong and powerful. But there was an observational study of individuals and their hand washing behavior, and it found that less than 6% of the sample study approached the recommended hand washing duration of 20 seconds. And something that I hear a lot, and I think a lot of us might be guilty of, is that we didn't realize that 20 seconds was a standard practice, that it wasn't something that came around because of COVID. We've been talking about 20 seconds for infectious and public health experts have been talking about washing your hands for 20 seconds for a while now, but less than 6% of the observed subjects, wash their hands for 20 seconds in the appropriate way. Far fewer, some people just put water on their hands. Some people didn't dry their hands properly. Some people didn't wash their hands at all. So a really great study to show that when how many people are not washing their hands appropriately. There's also some subsequent studies to show that having signage at sinks that encourages you to wash your hands is really powerful at getting people to kind of elicit this behavior, that having the right type of soap or hand dryers helps to kind of not only improve the hand washing experience, but also can have some other benefits like improving the indoor air quality. One thing that's kind of been really apparent is that clean sinks and clean countertops actually are a reason people don't wash their hands. So having those kind of protocols baked in to clean kind of bathroom sinks and to keep these places orderly is really important for making sure that not only do people wash their hands, but that they're going to wash their hands because it's clean, because they have the paper towels available, because there's soap in the dispensers, things like that. So a lot of research around not just kind of how to elicit appropriate hand washing behavior, but to really show how we can create an environment that promotes hand washing besides just putting up signs and telling people to wash their hands for 20 seconds. Next slide, Patrick. And then the final section, build occupant trust. This is looking at, again, resiliency and how we can create trust among occupants. And there's 3 minimum requirements here. Contagious disease outbreak plan is 3.1. This is really important. I think what I heard from most companies back in March was that they were a little bit caught unprepared to handle kind of the remote workforce, to handle some of the changes to supply chains that they had to put into place, some of the different business practices they needed to address. And why they had emergency preparedness plans for other scenarios, there was not a scenario in which they had to think about this kind of pandemic response or contagious disease outbreak plan. So establishing that as this kind of contagious disease outbreak preparedness plan as part of a larger emergency preparedness plan is really important for making sure that, again, the next time this happens, or the next time there's an outbreak, we're actually able to respond in a much more kind of unified and cohesive manner. This one has a couple dependent strategies, things like business continuity. So are you setting people up with the appropriate telework or technology, or providing them the appropriate resources to set up home offices? Mental health first aid responder plans. So there's a lot of organizations and cities that are offering kind of this mental health training for individuals to kind of identify things like acute stress, depression, and how they can be trained in certain de-escalation techniques. So having that, and then kind of design guidelines 3.1.3, looking at understanding what you can do within the space in terms of design. So spreading desks out, putting up sneeze guards or plexiglass dividers, things along those lines. 3.3, establish a communications plan. I always give the example, if you are updating your filters and you are cleaning more frequently, none of that is going to kind of build trust unless you communicate that to your tenants that you're doing it. By communicating these things that you're doing to help keep them safe or to promote and optimal health within their work environment, that's a great way to build trust and create conversations that are going to make people feel safe coming back to the workplace or engage or visiting common spaces and things along those lines. So having an established communications plan is key. And then finally, establishing a paid sick leave policy. We've seen that paid sick leave policies are actually really, really good at incentivizing people, or I should say, incentivizing people not to come to work when they don't feel well. And we know that there's a high amount of transmission that happens in the workplace for different diseases. So having these kind of paid sick leave policies for your employees on site goes really far in terms of preventing the spread of different contagious and respiratory infectious diseases. And this one's, I think, unique. The uniqueness of this one about Fitwel is really looking at, how do you give employees the information about when it's safe to come back to the workplace. So, if you do need to take time off because you are sick or a loved one is sick, how do you know it's safe to come back to the workplace to kind of maintain the effectiveness of that sick leave? Next slide, Patrick. And again, just to give you some insight on paid sick leave, a study and a literature review, I should say, in 2016 found that 16% of flu transmissions occurred in the workplace each year. So by offering sick leave, we're able to actually reduce the transmission or prevalence of the flu. So again, you can see here in a lower study, 1 or 2 paid sick days, even if it's just for the flu, can reduce workplace infections by about 25 to almost 40% respectively. So paid sick leave does have a huge impact on the transmission of different contagious and respiratory infectious diseases each year. And they go a long way to making sure that individuals do not come to the office when they're home. But it's also one of those things that works, I think, really well and shows the interrelatedness of some of these strategies. If you are not going to come to the office because you're sick, do you have kind of ability to get any work done? Sometimes people feel they have to come to the office, but it's great to see that there is kind of things like business continuity plans in place to help people even if they're feeling better, but maybe still within a window of, I don't necessarily feel safe or want to kind of put other people at risk. Can I still work from home? Can I still continue the responsibilities I have from home as well? Next slide, Patrick. And just to wrap up, if anyone's interested in any resources, you can go to fitwel.org. There's a whole page just on our bowel response module and the bowel response features. And I'll say there's a few documents that might be really helpful. There's a bowel response fact sheet that walks you through the entire certification process. There's also a bowel response module worksheet, where you can actually see all of the individual requirements and documentation needs for each strategy. You can calculate anticipated scores. So it's really good for kind of doing that initial gap analysis and understanding, where your organization or your client stands in terms of the requirements, getting a better handle for some of these strategies, especially ones that you are kind of maybe working with somebody to implement right now. And then certainly there's a couple webinar recordings from different conversations from some of our users that you can find on the website as well and download to watch some of those conversations about, why people have chosen to use the bowel response module and how it's kind of impacting their COVID-19 response plan. With that, I'll pass over to Patrick and we can jump into some of the Q&A. Or I should say Blake, actually.
We're basically twins. I'm the one that got all the recessive genes. Patrick got all the dominant genes in that relationship. Thanks, Mom and Dad. But anyhow, great presentation. That answered a lot of the questions that I had coming into this. So I'm having to scramble here, but to buy myself some time, I'll go to some that we got from the audience, and I'll go a little bit out of order, but I'll go in the order at which I think that we can handle these the best. So Seamus asked a question, is that I see sections on establishing an enhanced indoor air quality policy, which was covered in the presentation. But his question is, do you have any air monitoring systems that you recommend? And I'll tie that into a question that I have that wasn't covered in the presentation about crosswalks. So I'm familiar with the RESET program. I realize that Fitwel and RESET have some commonality there. So perhaps we could bundle both of those questions together to talk about air quality monitoring systems and programs that you would recommend.
Yeah, that's a great question. So we don't recommend, any specific product or organization. What we do provide is just an outline for if you're going to monitor your air continuously, these are the things you should be looking for. This is how you should set up those systems. Additionally, if you're going to be testing your air quality regularly, this is what you should look for and what you should be testing for. So we don't call out any specific product or any organization. I've seen successful programs done by a number of companies that our organizations have worked with. So I think it more matches on what's available in the location, what's reasonable, and who is providing the information, the services you need for your individual building or for the goals of your client.
And that's pretty standard across the board. I mean, LEED has historically shied away from product branding, so to speak, and more about general strategies that get you there, and then the product and the manufacturers will follow suit. So I think that certainly is consistent with what we would presume. We don't want this to be the industry specific standard. We want it to be about health and well-being and a standard for that. So that certainly makes sense. But I'm curious, if one were to find themselves in a situation where they were doing a RESET project, or they were doing LEED for existing buildings, operation and maintenance, what percentage, and you can take your best guess, you don't have to get this exactly right, what percentage of overlap between those two would you have in taking on this module?
Great question. I think a lot of companies have used their efforts with LEED or RESET or any of the other green certifications to really address some of our indoor air quality and indoor testing protocols. There are some just strategic differences though, right? LEED is coming from looking at air quality and air testing from an environmental impact and measuring the building's impact on the environment, where Fitwel is taking a much more health-focused lens. So I would say that a lot of our Fitwel users, especially with the building and site scorecards, already have achieved Fitwel certification, or I should say already have achieved LEED certification, or maybe BREEAM or RESET, or they're pursuing both certifications simultaneously. So they may have to make a few adjustments for their LEED documentation to fully qualify with Fitwel, because again, ours takes a little different approach when thinking about health and wellness. But within the building scorecards themselves, there are some direct alignment. So we talked about crosswalks there. For some of those strategies within the Fitwel building scorecards, you can get credit if you have achieved LEED certification using a specific kind of LEED product or certification, and pull that into your building or site scorecard. The module does not have any of those specific crosswalks, I'd say, because the language is so particular about infectious disease prevention, the prevention of the mitigation of viral response transmission. But certainly I've seen a lot of companies, as they begin to work with this module and achieve viral response certification, take what they've done with LEED in the past and enhance it to better match the language we've been providing today.
Great. I mean, so certainly there is a great deal of overlap. Certainly the LEED projects have, or even other certifications have a leg up, so to speak, just because they're already thinking about and addressing some of these factors. So thank you for that response. Let's get to Elena's question. She actually had a good one. She wants to know is for projects pursuing Fitwel, and she asked Fitwel specifically, but I'll expand the scope of the question to talk about other certifications, because at least in our practice, we're seeing Fitwel used in conjunction with LEED. And LEED came out first, and it's focused on sustainability, and Fitwel focuses on health and well-being, and they both have their unique value propositions. I don't think that there's any struggle between that, at least on our clients. They see the value behind it, and maybe we can talk about that later, but we're using it in conjunction. So that maybe is why she's focused the question. So for projects that are pursuing and or have recently achieved Fitwel certification, is there a streamlined pathway and or a cost reduction for the viral response?
There was until recently. So for those projects who had achieved Fitwel certification or prior to December 15th, just yesterday, they could apply the module at the asset level at no cost. But the pricing for the module is pretty reasonable, I'd say, again, for an entire company or organization to achieve viral response certification. It's a flat fee of $4,500 for that step one. So even if you had kind of millions of square feet of space, or you had kind of close to more than 100 assets, it's $4,500, and then each individual asset is $200. So the asset level approach is pretty reasonable. And as you have kind of large portfolios attempting this, or even just kind of regional portfolios across, let's say, the New York City Metro or the Boston Metro, you'd be able to apply it at a reasonable rate that's less than what you see for our kind of Fitwel building scorecards.
I would agree with that. I mean, at least again, I'm referencing my practice, and I'll encourage others to chime in on their experience with this. But, you know, we've seen the price point for this really match where the market is comfortable. And you guys have taken the high road of putting a lump sum amount not tied to square footage, which other rating systems have done to their detriment, because once you get into the larger buildings, in my opinion, I feel like it precludes them from wanting to do these maximum benefit health and well-being strategies, just because they're somewhat punishing you, right, if you're a larger building, whereas you're actually encouraging small buildings to jump in, as well as the bigger buildings are just saying, hey, this makes perfect sense to wrap in while we're doing some of these strategies. So I think that's interesting. Another thing that Fitwel has done, and I'd like to ask this question, is why is it that you've, whereas other rating systems have targeted the individual project, right? You guys are more in the business of targeting the decision maker client portfolio, right? You start with the asset in step one, and then you move, or you start with sort of the client portfolio in step one, and then you move to the individual assets, which is sort of unique. So tell us, if you could give us a glimpse under the hood about what drove that decision, and is that working?
Yeah, great question. And I think it's working incredibly well. And I think it's really meeting the need of our users out there in the community. One reason, is because what we were hearing from large companies was that each different asset managers or portfolio managers or facility managers were reaching out and saying, these are the things that I want to do in the building. These are the things I'm going to put in place to address COVID-19 and address the needs of my occupants or my tenants. And they really wanted a singular response or approach. And they wanted something that was scalable and that they could give out to everybody. So by having step one really focus at the corporate or decision maker level, you're able to set that playbook that everyone can put into action. And by doing so, you have a really consistent approach, which is great for not only your own team internally, because you can say that what we're doing in building one, we're also doing in building two. What we're doing in New York, we're also doing in Boston. But at the same time, you communicate to tenants or the community that any building they enter that's under your kind of portfolio is going to have some of the same things in place. They're going to have the same protocols, the same practices. It's not going to change dramatically whether you go into a building in Manhattan and then you end up at a building in White Plains. And that's important, I think, as we see people changing their work behaviors and saying, I might be working from our downtown headquarters 1 or 2 days a week, but I'm also working from some of those spoke locations another day or two a week. They can trust that no matter where they go, they're going to be able to have the same safety measures taken. And when we look at health, and I think the way we designed the entire certification system is that we don't want just the headquarters downtown, that flagship, to get access to health. Health is not something that's just reserved for the C-suite. it's for everyone. So if you have a headquarters downtown and then regional offices in the suburbs or different cities across the country, we want to make sure that you can easily and effectively apply these health programs everywhere. And that's really how you impact change and drive the solutions. And it's a way for us to be able to help a company say, if you want to take these wonderful indoor air quality measurements and tactics, it's not just for your one new construction project in the Back Bay or the financial district. It's something you can do for all of your offices, existing Class A, Class B. And that's, I think, really how you impact health and create that culture that health is part of the decision making, and that's a value that you can translate to your employees and to your tenants as well.
Yeah, it's an interesting take. I love to think that White Plains is the stellar opposite end of the universe as New York. And maybe some will agree, but you never know. It's going to be the next New York once everybody splits. I think
I'd actually like to jump in, Blake, on this discussion about the portfolio kind of approach. A lot of designers in the Boston design community, both because of just the nature of New England and Boston, but also just our practices, do a lot of higher education work, a lot of colleges and university work. And there you have, certainly campus level policy, but you have a range of different types of buildings. You have res halls, classroom buildings, laboratories, et cetera. Am I correct in interpreting that the same kind of approach of taking a portfolio level, certification, and then applying that to individual assets or a campus, like the individual buildings, regardless of their type, would be how we would advise our academic clients to pursue this?
Absolutely, and Patrick, that's a great example. I think when we talk to a lot of K-12 school districts or higher education institutions that have kind of large campuses with really diverse types of buildings and building uses, this is exactly how the module was designed, and where it's really effective is that a college or a higher education institution can adopt the module for their entire campus, or maybe even campuses. Maybe they have different locations for things like law schools or business schools, and then take those policies and protocols and apply it to each individual building. Because certainly residence halls versus libraries versus lab spaces are going to have unique challenges, and how they think about things like ventilation, how they think about things like where they might need specific signage, or where they might need to put things like surface sanitizing stations. So being able to adopt those protocols at the institutional level really communicates to their stakeholders and prospective students and families that they've taken the right steps, and then they can take those policies and make sure that they're effectively applied at different buildings based off their asset type, so that they're not just putting everything in the same place no matter the building, because that's not really going to be the most effective, especially when you think of something like, again, a lab versus a residence hall.
Yeah, one of our interesting experiences on one building on a campus that we're working on and pursuing a Fitwel certification for, the discussions with the policymakers and the kind of campus-wide leaders about that one facility even triggered campus-wide discussions about policy. And interestingly, this one building pursuing a Fitwel certification is the impetus or the vehicle that they're using to implement a campus-wide smoking ban, rather than just within the 25 feet of entrances or things like that. And so it's been an interesting, because of the focus on policy, and because you're already involving those decision makers, it's been interesting to scale up the impact of any one individual project that we're working on with a client to an entire portfolio.
Yeah, and I hear that a lot, that sometimes it's the experience of one project that they begin to see how they can take some of these things and actually apply them more broadly, and actually how they can kind of scale different policies or design solutions and make them kind of codify them across all of their campus or all of their site. But that's great to hear that you've had success in kind of driving the conversation around health, from one building to more of a campus-wide look at how they can kind of improve the health of students and occupants and visitors.
So I want to ask one more question that came in. This one came from Michael, and it's a good one. I would almost like to ask him to ask it, but I think I'm going to paraphrase it for him, and hopefully this hits the spirit of it. So, because it's something that I've been talking a lot about, is that we took for granted for a long time that cities would exist and we could come and go as we please, and we didn't have to worry about the health and wellness attributes, right? It's almost as though it was our own personal responsibility. Just like with the structure of the building, we assume it won't fall on our heads when we walk in the door. Now we are in this conundrum where we have to regain the trust of the general population to come back into the workplace, but beyond that into cities, which is a much bigger conversation, because we can make the workplaces as healthy as possible. But if the way that you get to and from work isn't supporting of that, then what have you really accomplished? But Michael brings up a really great point with this regaining of trust, and I think it's interesting that you've even worded it, the section, the same way that we've been talking about it internally. Has the module Fitwel certification broadly been utilized in any litigious way to sort of the defense of a client who maybe is being sued for the spread of COVID? Or do you see there's a possibility for that in the future, to sort of utilize these evidence-based approaches as verification in a situation where we have arbitration?
Yeah, for making my question more understandable. I think you've related it well. It reminds me of a professional and the idea of the standard of care. These businesses do want to do a good job, but they're asking themselves, how do we do a good job? How do we demonstrate that we've done a good job? By what means can we claim that we've done a good job? And I think the certifications that you're offering are likely to come into play in that story.
Well, the question really is that, I mean, it's an award that you get, and it's certainly above and beyond, but is it enough?
So, I mean, it's a wonder. All of our strategies are founded in that really strong evidence base, and I'd go back to that a little bit. That nothing here is a best practice or based off anecdotal support. It's all founded in a very wide body of evidence that makes it credible, that makes it proven, and shown the potential impact. But by no means through this Fitwel response certification are we claiming to prevent any COVID-19 or any contagious disease transmission within your building. What we're providing you is a playbook of strategies that allow you to mitigate that spread and understand how you can reduce the risk within those individual buildings through kind of the science-backed strategy. So, there's certainly a conversation around how do we create spaces that are where we build trust. And I think part of that is making sure that we're not communicating that this is a COVID-free space, but that we're communicating that we've taken the right steps to provide as safe of a space as possible. Very few things in life are 100%. And when we look at how we design buildings to promote indoor air, positive indoor air quality, when we look at ways to reduce potential pollutants or contaminants within these spaces, we're providing a evidence-based and credible solution that allows you to say, we've put in the effort to make sure that this space is safe, is resilient, and will promote your health. But part of that also comes back to individual usage and behavior, and that's where Section 2 is really important. How do we drive decision making, right? You can do all the wonderful things around ventilation and around cleaning, but if we're not eliciting certain behaviors out of people within buildings, there's only so much that you can control. And again, that goes back to we're reducing the risk and the spread of these contagious and respiratory infectious diseases. We're not eliminating them completely. That would be a claim that Fitwel will not make, and that I am always making sure that nobody, whether a client, or project or project team, can make that claim either. I push back on any claim from a certification like Fitwel or any other program out there or tool out there to help companies kind of, again, build that trust and get people back to the workplace or get people back to kind of their typical routines. This is about, taking the right steps, providing the right level of information, communicating what you're doing and why you're doing it, and allowing people to kind of come back as they feel comfortable, come back as they feel it's appropriate and safe for not only themselves, but their households and their families. And by doing that and having that information laid out in kind of business continuity plans and family support policies, you're actually, I think, able to create that trust and build that kind of resiliency and make sure that stakeholders are aware that you're taking the appropriate efforts and really being a leader in kind of our thinking about our workplaces, post-COVID-19.
It's great.
Blake, let me stop you here. We're pretty much at time, but I want to thank Zachary, you again for the great presentation and discussion, and thank you, Blake, for leading the conversation and the thought-provoking questions from everyone that were contributed. So once again, this session was eligible for continuing education credit. So if you haven't yet, go to the chat, get that link, and submit your information. This event was recorded and will be posted on the BSA's website. So anyone that knows a client or a colleague that could benefit from watching this discussion, please share that with them once it's posted on the BSA's website. And again, just thank you very much. We look forward to seeing you next month for the event with Ground Reconsider that Michael presented on January 20th. And until then, stay safe, have a good holiday, and we'll see you in the new year.
Thank you.
So thanks, Zachary. That was terrific.
Yep.
Thanks, Michael. Thanks, Patrick. Thank you, Blake.
Take care, everybody.